Good evening. I am Heather Baker, the board president of the Center for Hearing and Communication, and I am pleased to welcome you to tonight's webinar, Hearing Health Today, a conversation with Dr. Tom Roland and Dr. Nancy Rennert, who will be providing a close look at the impact of COVID on hearing loss and tinnitus, and discuss ways to navigate healthcare with the ongoing challenges of face masks. Before we get started, I want to call your attention to our accessibility features tonight. We have both a sign language interpreter and real live captioning, known as CART. To access the captioning, simply click the CC button on the bottom of your Zoom screen. If you need any help or have technical difficulties, you can send your questions into the chat and a CHC staff member will assist you. Tonight's event will be addressing a topic that is of critical importance to everyone with hearing loss, to all of us at CHC, and to me personally. As a cochlear implant and hearing aid user myself, this past year has presented numerous communication challenges for me. At doctor's offices, in stores, with my children's teachers, with my friends, just about everywhere. While I am thrilled, as I'm sure you all are, that it seems like we are coming out of this difficult time and that some of the guidelines for face masks are being lifted, in certain settings like doctor's offices, face masks will be here to stay for a while. And that is why this evening's conversation is so important, and why CHC's expert care makes such a difference in the lives of people with hearing loss. And so now I'd like to introduce you to CHC's Executive Director, Dr. Lori Hannon, who will lead us through this evening's program.
Thank you so much, Heather. I'm so glad that we have so many of you joining us tonight for what I'm sure will be two very interesting and informative presentations. CHC is a private, not-for-profit center providing audiology, hearing aid dispensing, tinnitus treatment, speech and language therapy, and mental health counseling to people with all degrees of hearing loss. We also provide community outreach programs such as tonight's webinar. It's been a very challenging year for everyone. At CHC, prior to the pandemic, we provided a small portion of our services by telehealth, and this year, most of our therapy services have been provided this way. We have happily been open on site for audiology since last July, and are able now to provide all of our services remotely or in person, whatever our clients want. Now, it's my great pleasure to introduce Dr. Tom Roland, who will talk about hearing-related side effects from COVID, what they are, and what you can do if you're experiencing any of these. Dr. Roland is the Mendek Foundation Chairman of the Otolaryngology Head and Neck Surgery Department at the NYU Langone Medical Center and CHC's Medical Director. After Dr. Roland speaks, we'll be able to take a few questions. Please put them in the Q&A if you have questions for him, and we'll address as many as possible. So Dr. Roland, I leave this to you. Thank you so much for being with us tonight.
Thank you, Lori, and thank you for the invitation. Lori asked me to talk about the relationship between COVID and hearing loss and tinnitus, and I thought I would try to answer a few questions through this talk and then be more than happy to take questions later. So my first question that we're going to try to answer tonight is, does COVID or COVID-19 cause hearing loss? The second question, which is a hot issue right now, or do the vaccines cause hearing loss or increased tinnitus? What are some of the possible mechanisms that either might cause hearing loss? And what sort of an evaluation might one undergo, and what kind of early treatment might be available if someone is diagnosed with hearing loss related to COVID, or suspects hearing loss related to COVID? So my interactions actually as a hearing doctor is, we had a patient who, and I was actually surprised that I wasn't seeing more hearing loss among especially the very ill patients that were in the ICUs, and the ICUs were just packed to the gills in the early days of COVID here in New York City. But I had a patient that came to see me who got very ill. He was in his late 30s, and he was in a hospital in New Jersey. And when he came out of coma and survived, fortunately, he noticed that he couldn't hear in one ear and had loud roaring tinnitus in one ear. and an evaluation revealed he had profound hearing loss. An MRI didn't show anything, a stroke or some of the other neurologic problems that we are seeing in patients who had severe COVID, but he nonetheless had the problem. And we treated him with a cochlear implant, and it actually worked. It brought hearing back and suppressed his tinnitus, and he's quite happy. But that led to some other questions as to, why might this have happened? Now, one of the reasons it might have happened is some of these patients were very, very ill. They were in an ICU, they were in induced comas, they were intubated or had tracheostomies, they had massive blood pressure fluctuations, some of them required transfusions, hemodialysis, ECMO support. I mean, these were very, very ill patients. And so we do know that patients in ICUs that have extreme illnesses do have hearing loss for all kinds of reasons, toxic reasons and blood pressure related reasons, etc. But the other thing we know about the COVID virus, because of the way it behaves, it forms microemboli. It causes platelets to clot around it and form these little balls or emboli that can cause all kinds of tissue damage all over the body. And in some of the early days of COVID, on some of the autopsies of our patients, we found microemboli in hearts and livers and kidneys and brains of patients. And we even had people that had heart attacks that didn't have coronary artery disease because the microemboli occurred. Now, the COVID virus needs to attach to an enzyme called the angiotensin converting enzyme 2, ACE2. It's a receptor, and the COVID virus attaches to it. But that receptor is found in almost all of our organs in our body, and also in the linings of all of our blood vessels, including the linings of the blood vessels of the brain, and even in the inner ear, this receptor has been found. But we also know that it needs a second sort of stimulus called a transmembrane protease serine 2. And when both of those exist, then the virus can easily enter the body, enter the bloodstream, enter the cells. So maybe this second enzyme doesn't exist in our inner ears. We do know that the inner ear, especially the basal turn, has high concentrations of ACE2 enzyme terminals where the virus could attach. So in general, there also have been reports of patients experiencing hearing loss and tinnitus after the vaccine. And it's as high as maybe 7 to 14% in some series. I was just on a YouTube channel with India, who is being hit very hard right now with COVID. And they're reporting, and I'm not sure what their source was or where the data came from, up to a 14% incidence of people with hearing loss. We do know that loss of smell, there's a very high incidence of loss of smell for a different mechanism, but not a very high incidence of hearing loss. Just recently, there was an article published where a researcher from Johns Hopkins looked at all the available data out there and did sort of a meta-analysis on the incidence of hearing loss related to the vaccine, and they did not find any correlation between the vaccine and hearing loss. There are some anecdotal reports on my otologic chat rooms around the country. People are asking each other, have you seen this? Have you seen it? A group in Boston told me they've seen 4 cases of patients they think had hearing loss or increased tinnitus after receiving the vaccine. But I asked about the patients, and all 4 of them had pre-existing hearing losses and had progressive hearing losses. So we're just not sure. Just like you can get hearing loss after any virus, a bad cold, one can end up with a hearing loss. So in general, I think if someone feels that they have a hearing loss, and I don't think that hearing loss to date has been a presenting symptom of COVID like anosmia or loss of smell. It was almost synonymous with COVID. If you lost your smell during COVID, you probably were in the early stages of an infection. But I don't think hearing loss is the same. But if you were sick or think you're getting sick with a cold, just like anytime you have a virus and you're worried about your hearing, it is a good idea to seek medical attention, because early diagnosis and early treatment may make a difference. We probably would treat or consider treating if we really felt that you were sick with the virus and we're having hearing loss or increased tinnitus as a result. They often go hand in hand. We might encourage you to take antioxidants and or steroids early in the treatment. They may help. We're also getting MRIs. We're beginning to find some MRI findings. There was one report that was microhemorrhage in a cochlea in one patient at Columbia University that had hearing loss. Our patient had just the opposite. He had an embolus, so he had lack of blood supply to his cochlea, we think, based on his MRI findings. But it's really hard to know the exact data. So I think people are beginning to start to collect this data more and more. But I don't honestly feel that one should be afraid to get the vaccine. I think the risk of getting very ill from COVID, especially some of the new variants, far exceeds any potential slight risk of inner ear issues related to getting the vaccine. So I think that sort of covers my 4 questions quite well. I'm happy, Laurie, if you have questions on the Q&A that you want me to answer or to speak about, or if you have any other questions.
Sure, it's very interesting, and a couple questions have come in, and some did come in before as well that are tangentially related to what you said. So one question came in that's actually different from what you spoke about, though related to the vaccines. And the person wanted to know if there's any research on vaccines and any effects on cochlear implants. And their thought was that Pfizer and Moderna use mRNA technology, Johnson & Johnson a more conventional vaccine. And is there any risk or any concern that the body could reject an implant after a vaccine?
No, I think I can honestly say absolutely not. Having thousands and thousands of patients with cochlear implants, and we would certainly hear about that around the world. I think, and that might be true of any vaccine that we take, whether it's the yearly influenza vaccine, or I travel around the world and often taking all kinds of vaccines for things like yellow fever and cholera and typhoid and all those things. And I don't think there's any fear or worry whatsoever.
I think that's a great answer, and I'm sure it's going to make the person feel an awful lot better. So I guess here's a question then: if there is seems to certainly be a relationship, should everybody who had COVID get a hearing test? I mean, obviously, if they feel they have a hearing loss, yes, but would you recommend that anybody that had COVID get a hearing test as a baseline?
I'm not sure. I mean, I don't think at a certain age we recommend everybody get a baseline hearing test, and children get baseline hearing tests at different stages of their development and education. I don't know that anything special. I do think it's not a bad idea to keep an eye open, because I know some centers are beginning to study long-term effects from COVID. This sort of post-COVID syndrome, which is more of a psychological effect or neurological effect from brain injury and encephalitis and meningitis and all those sort of things that you get from COVID. But I think there are centers going to begin to study this systematically. We're beginning to think about setting up a database. Probably everyone that was positive, we'd like to just get a basic sense of the incidence of hearing loss in that population. Now, the problem is going to be that we don't have a hearing test most likely before COVID. So we don't know if this is new or old. It's like the same problem you have with any kind of large scale screening.
That's interesting. Now, so if someone had a hearing loss related to COVID and it was early on, so they were just getting sick, they felt the hearing was being affected, you spoke about, what you might do as a physician right then and there. If it's now a little bit down the road, so somebody had COVID and they have a hearing loss now, they believe so, is the treatment for it at that point, do you think, any different than for any other sensory neural loss?
Maybe, I mean, one of the questions we always ask is, when is it too late to consider giving steroids? And will they have an effect? We tend to think giving steroids during the early phases of a new onset of hearing loss might make a difference, especially if it was something inflammatory or infectious like a virus. But so I think we still might consider doing it. I mean, obviously, if the patient had a reason not to take steroids, like they were severe, had diabetes or brittle diabetes or something like that, or there was a reason not to do it, I probably wouldn't do it. But and our endocrinologist speaker who's coming up next might even speak to steroids, although she's talking about a totally different subject, but about the harm in steroids related to COVID. But I think that there's been some good evidence that getting a dose of steroids on early is probably the best thing you can possibly do if you have a new onset hearing loss.
That's great advice for everybody. And again, hopefully it's becoming a thing of the past, but it's really good information for us to have. So A question just about generally about tinnitus that came in earlier. I would like your take on. It's not really related to COVID. Someone wrote that their mother is 70 years old and has been struggling with tinnitus for a long time. She hasn't talked to anybody other than her regular doctor, who said that he had nothing to offer. What would the first step be? I know what I might think it would be, but what should somebody like that
Well,
do
they
first?
should get a good audiogram, and they should probably have a good examination and a history and a physical by a good ENT or specifically an otologist. Sometimes there are treatable forms of tinnitus. One of the things we have to do as a physician is make sure this tinnitus is not a manifestation of something more severe, more sinister, something we should be taking a closer look at, especially if it's one-sided or one side's much worse than the other, if there's asymmetry in the tinnitus or the hearing loss. And then, as you know, there are different therapies that are somewhat, quite effective. Some are more effective than others, and one therapy might be better for one person and another therapy for another. I know you folks at the CHC are experts at tinnitus retraining therapy, and it's been very effective in the patients that we referred there. And there are other forms of therapies emerging. And sometimes usually tinnitus, especially in a 70-some-year-old, is just a high frequency sensory neural hearing loss, manifestation. And so treating that patient with high frequency hearing aids might make a big difference. It will mask the tinnitus and improve their hearing and quality of life.
Okay, great. Thank you. Kind of similar to what I might say, but I stay away from the medical questions. Out of my scope of practice, happily. Not happily, but good for the clients that it is. So another question that's again related to COVID. Someone wrote in, they have had a hearing loss for some time and had COVID about 6 months ago, and now the hearing loss is worse. They're told that now they might be a candidate for a cochlear implant. Is it safe for them to get a cochlear implant if the change in hearing is due to COVID? Are there any risks that they need to pay attention to that they wouldn't otherwise?
No, I think it's perfectly safe. And the mechanism, they have further inner ear hair cell damage. They're probably headed in that direction, maybe more slowly anyway. And the COVID infection, a viral infection, just sped up the process most likely. So I think there's no reason not to have a cochlear implant. There's no medical reason why having a cochlear implant after a COVID infection is more dangerous.
I think there's time for one or two questions. There's one quick one. I have a feeling you could answer quickly. So this tinnitus and hearing loss are related, shown as a sequel of COVID. What about dizziness or vertigo? Has that been associated with it at all?
Yeah, that is a good question. And often hearing loss, tinnitus, and dizziness and vertigo go hand in hand because it's all part of the labyrinth, the vestibular labyrinth and the cochlear labyrinth. And the same mechanisms that can cause hearing loss can also cause vestibular dysfunction because we have hair cells on that side of things as well. So yes, and I think the incidence actually of vestibular problems was slightly higher than the incidence of hearing loss and tinnitus problems, but it's usually transient. The body, things sort of get better often with dizziness because you compensate, you have central compensation. So I think that I think there was as high as 14% in one study that I looked at. But you can get dizzy, you can get a viral labyrinthitis after a very bad cold and be dizzy for a week and have nausea and vomiting and spinning. And you can get disequilibrium and dizziness for a number of reasons. So if someone feels like they've had more dizziness or disequilibrium or vertigo after COVID, they should be evaluated as well.
Okay, good to know. And I guess it's just one last question that occurs to me after you're talking about COVID. Is the hearing loss that's related to COVID or the increase, is it something that could potentially recover on its own? Have you seen instances of that, or is it typically requiring treatment if it should to help it recover?
I have seen, often have seen inner ear hearing loss, sensory neural hearing loss, or sudden idiopathic sensory neural hearing loss recover on its own and or after steroid treatment. And so I don't see why COVID wouldn't be any different. I don't have any experience with having someone who's come to me just yet who said, I lost my hearing. I was sick with COVID the last 4 weeks, and now I think I've lost more hearing. I haven't had that patient yet and have seen recovery. I'm not sure that anybody has a lot of those patients, which is probably a good thing.
Yeah, it sounds like it. There's still so much unknown. I think that's all that we have time for right now. And I can't thank you enough for coming and sharing everything that you know with us. We love to have you. And it's really helpful, I think, for a lot of people who probably have been walking around feeling like maybe they have a problem after COVID with hearing loss or the tinnitus. And it's not something that you read about that much in the mainstream newspapers. And I think that it's something that people probably worry about. And I think it's really helpful for them to have you here. So thank you so much for joining us. It's always a pleasure, and hopefully we'll get to hear from you again.
Well, thanks. Thanks for having me as usual. And thanks again to the CHC for sponsoring these events. I really enjoy doing them. Thank you.
We enjoy having you. Thanks. Okay, so now I'm happy to introduce now Carolyn Stern. Carolyn is going to introduce our next speaker. Carolyn is a colleague of mine at CHC who directs our community outreach program. So welcome to Carolyn.
Thank you, Lori. Now I am excited to kick off our next topic, navigating healthcare today, clear mask and more. It's my pleasure to introduce our next medical expert, Dr. Nancy Rennert. Dr. Rennert is System Chief of Diabetes of Nuvance Health. She's also the Chief of Endocrinology at Norwalk Hospital and an Associate Clinical Professor at the Yale School of Medicine. Dr. Rennert is also a bilateral cochlear implant user. That experience, combined with her extensive medical career and also working on the front line of the pandemic from the very beginning, gives her a unique perspective on the topic at hand. Please join me in welcoming Dr. Rennert.
Thank you, Carolyn. Thank you for that kind introduction and for inviting me. So the past year plus, our lives changed. I experienced this from many perspectives. Professionally, as a physician, we changed to telehealth platforms as well as seeing people in person. As a medical educator, as the leader of my subspecialty division, and personally, as a parent. Children came home, school was on Zoom, they were working remotely, and all the time I was trying to keep my family safe and healthy. Sound familiar? Also, as a caregiver to a family member with a prolonged hospitalization at a time of no visitors, limited communication, where I felt marginalized due to my hearing loss. And as a patient, the pandemic coincided with my first year after revision surgery for a failed cochlear implant. And those of you who know firsthand or even secondhand about this, it's a huge amount of work and gradual adaptation. So with all of those challenges, I had to figure out how to navigate it, and face masks were everywhere. This led me to explore clear face masks, which is one strategy that helps. So I'm going to share what I learned in the hopes that I can make it easier for someone else. With this pandemic, we're clearly in a better place now, here, than we were a year or more ago. We've learned a lot, we have vaccines, and as you know, recommendations recently changed to allow certain groups of people to go without masks in certain situations. But in select settings, such as healthcare, masks continue, and they may be with us for some time. So I'm going to focus on the healthcare environment and offer some ideas on how to cope. There was a recent study in a surgical journal which showed a strong patient preference for clear masks in healthcare settings. These were random patients, range of ages. They were not selected for hearing loss. It's not surprising that most patients would like to see the faces of those taking care of them, but it was documented. So lists are popular, and I am going to talk about the top 5 things that I learned about face masks and clear face masks. Number 1, safety. Number 2, fit. Number 3, comfort. Number 4, sound. And number 5, approach. I think we've all become very familiar with face masks, probably more than we ever anticipated we would be or ever wanted to be. So I'm going to just talk very briefly about the first three, and then I'm going to focus on the last two. So safety, protection, I mean, that's why we're wearing the mask. In general, you want to match the type of mask with the risk. It's situation dependent. There's a spectrum, cloth masks, surgical masks, which are mostly made of paper, various thickness. There's the KN95s, those are imported intermediate masks, and N95 respirators, and on up. And those are most often used in medical settings. And now these are all terms that we all know. Number two is fit. The idea is to minimize the airflow. There's three main considerations for that: the sides, the nose, and the chin. Number three, comfort. In healthcare, we wear these masks for very long periods of time, sometimes more than 12 hours. So comfort is important. There's a lot of different aspects to it. One is the distance from the face to the mask, or in the case of a clear mask, the clear window or the plastic. Clear masks can have issues with fogging and condensation. And then how do you attach the mask to your head, right? I mean, there's ear loops, there's ties, there's head straps. And for those of us who have hearing instruments or hearing instruments and eyeglasses, sometimes having head straps or ties might be more comfortable. So now let's get to sound. In general, all face masks decrease sound. More protective masks, like N95s, decrease sound more. It's not an even loss. There's a greater decrease in the higher frequencies, so the sound kind of gets distorted. So hearing devices can be programmed or mapped to compensate for that by selectively increasing those frequencies. I would encourage you to do that. Try it if you haven't already. I do find it helpful. So in addition to the sound loss of a mask, if you add another mask, or if you add a full face shield, it makes it even worse. Face shields alone distort sound very significantly, usually more than most face masks. So there have been a few studies in the literature recently that look at sound with various face masks, clear and opaque. Some of them are done in acoustic labs where the variables are all controlled, and some of them in more kind of real world situations. And here are my takeaways on those. Clear masks, clear face masks, they seem to decrease sound more than non-clear face masks. This is super disappointing, but it's true. In general, the larger the clear window, the greater the loss of sound. It is going to depend somewhat on the type of material, the thickness of the material, but it's generally the way it works. Full face shields being the situation where there's the most distortion or sound loss. But the clear upside of a face mask that has a clear window is that it gives a visual, which, as we know, is critical for lip reading, speech reading, and seeing expressions. It's important for communication for everyone, and it can be a lifeline for those of us with hearing loss. So my advice is, if you are choosing a particular clear face mask, and assuming you can choose, I would recommend that you try several of them and find your personal sweet spot, because there's a trade-off between sound loss and visual access. As you increase the size of the clear part, the sound decreases. So each person, I think, will have their individual best mask. So number 5, approach. This is something I learned. It's useful to understand how you approach communicating with face masks. There's definitely an emotional or psychological component, and there's a potential for a freeze up, especially if the communication is unexpected and the speaker is unknown. Will they have a soft voice? Will they have an accent? Will they be a rapid talker? This happens to me because I'm so used to using multiple strategies, it's almost like a reflex. And that when one is taken away, the vision, it's jolting. And it can cause anxiety, which makes it worse, I think. So one of the best parts of having a clear face mask is that it can also allow you to have that visual, relax more, and then just listen. And as part of the approach, I want to include respect. Everyone is different, and it's important to consider the other person. Communication is always a two-way street. Consider their preferences and try to work with it. So at this point, I am going to call Carolyn Stern back, and we are going to show you some of the clear face masks. I want to acknowledge that there are some of these manufacturers are on this call. I want to thank them for providing samples and for soliciting our user feedback. I also want to say that Carolyn was my partner in crime on this, and this is as much hers as mine. So as we organize this, we're gonna show them in the order of the increasing size of the clear window. We're gonna provide you a list with websites, further information, so don't worry about all the details. These are examples. They're chosen to illustrate certain features. There are other masks that are available now, and there are additional masks that are in development. Okay, so let's have the first mask. So this one is an example of a combination cloth and vinyl mask. This particular one is manufactured, but people were making them at home. It's washable, it's reusable. It is not usually acceptable in a medical setting for a healthcare professional. The next one is called the Safe and Clear mask, or the communicator mask. This one was FDA cleared a few years prior to the pandemic. Sometimes it's called the smile mask. It's equivalent to a surgical mask. The next one, this one is called the Face View. And you will notice that the sides of the mask are covered for a tight fit, but there's also less of a lateral view when you're speaking. There's more space between the face and the front of the mask, and this particular one comes in one size only at the current time. The next one is called the bend shape mask. You can see this has a much larger window. It actually will unlock your iPhone facial recognition. And this one comes in several sizes, and there's an option for head straps. The next one is called the clear mask. It's pretty much all clear window, and you'll notice that the sides are open, and you really can't change that. And the last one, this is an example of an all vinyl, completely visual mask. And there are issues that have to be addressed with these, such as condensation, and you can use like a defogger solution like you would use for swim goggles. So the development, as I said, on these masks is ongoing. They're going through the regulatory process in the FDA, which is stepwise. Thank you, Carolyn. And also the companies are working to produce more protective clear masks similar to N95 respirators for use in healthcare. So now I want to move to advocacy, and I'm going to address two questions. How do you ask someone to wear a clear face mask? And I'm going to use the example in the medical setting. And what do you do when they say no or not now? Because that will happen. So I look at advocacy on multiple levels. All of them are important, right? There could be awareness campaigns, media, social media, lobbying, legal actions. I'm going to focus on what you as an individual can do in the moment. I don't think it's talked about that much, and I have experience with it. So what you can do to improve communication in the healthcare setting at what we call the point of care. Clear masks are one strategy. There are many others, and they add up. So Carolyn Stern and I published a short piece in December entitled Optimizing Healthcare Visits with a Hearing Loss. We're going to include that in the references. And the idea was to address the additional barriers faced by those of us with hearing loss in accessing medical care because of face masks, because of no visitors, because of no in-person interpreters. And we looked at a non-emergency healthcare visit in 3 time frames: the preparation before, during the actual visit, and after. These are all times to advocate for clear face masks. What I recommend is, prior to your appointment in the office or in the hospital, contact and make your request for clear masks. Also find out what's available and what could be available. Be specific. You know what's going to help you best. During, and you have to feel comfortable with this, but I do, I bring along some samples, and maybe even you could wear one yourself and ask members of the healthcare team if they would consider using it if they're not already. After the visit, if it was helpful, let them know. Be positive, maybe add additional suggestions. For example, if they had a clear mask and it helped you, but you could also ask, well, you know, it was far away, maybe I couldn't see it as much. You could say, well, would you consider using a video language interpretation system? I use this a lot with patients. There's many different ones. A couple of the ones that I have are called Stratus or Marty. But the idea is that they are language translation, primarily for non-English speaking patients. They all have ASL. They do not have oral interpreters per se, but the employees are all chosen because they're clear speakers and they all speak English. So what I usually do is choose a common language like Spanish, talk to the interpreter, tell them what we want to do. And the good thing is that it can change the volume, you can bring it very close to the patient, and the interpreter is not wearing masks. So after the visit, you will often receive a survey, usually in your email. A common one is called Press Ganey, but there's other ones. All of them are going to have a question that goes something like this because it's so important. It's going to say, did the doctor or clinician explain things to you in a way that you could understand? If the answer is no, say no, or number 1, or fail. There's no other way they're going to know that. So you could choose to give details or not. I would recommend at least saying something like, the disability accommodation I requested in advance was not provided and I could not understand. And then I would recommend putting in deaf or hearing impaired, just so they know kind of, you know, what area you're talking about. A lot of times you get surveys and, you know, you think, oh, no one's going to read this, just a waste of my time. But I can tell you that this information does get collated, and repeated comments or ones that especially stand out, and this would stand out, do get discussed with the doctors and their staff. I have a few of them on my desk right now that I have to talk to people about. So, so I would encourage you to use that. So now, what if the answer you ask about the clear face mask and the answer is no, or not now? Why would somebody say no? You might think, well, you know, it's just going to help me. Why would they say no? So the most common reason for that is concern around safety or fit, maybe time. I'm not aware of any currently available clear mask that is more protective than a surgical mask equivalency. So if the healthcare provider feels that he or she wants a more protective mask, it may be a no or a not now. In addition, the whole thing just may be unfamiliar or uncertain. My advice when you're in the moment is just to respect that and try to work with it. So try to find the common goal. You know, if it's a no, you can say something like, okay, you know, I get it, I understand. But then follow it up with, well, what can we do? You know, make it a we to communicate better and improve my health, or whatever is your specific goal, lower my blood pressure, or whatever it is, right? So if you can engage that person to work together. Maybe educate if it feels right. You can give them some ideas. Sometimes the folks who work at the front desk staff are just doing whatever. They're bringing in their cloth masks from home. That might be an opportunity to use clear masks. Also, I have seen people do kind of a hybrid where they will use clear masks during discussions with patients where they're maybe more distanced, and then they'll use perhaps their preferred mask during an examination or a procedure when they are closer. So I think it's also important to never depend on one thing. It's really helpful to have, you know, plan A, B, C, I don't know, maybe even D. This is detailed in the publication, and I'm just going to bullet point it here so that you get an understanding that there are a lot of things you could do. So connecting and finding an ally on the medical team is really important. It's usually not the doctor, although the doctor usually has to be aware. Learning how to use in-person and virtual visits, or both. Exploring technology options, and here's where there's a lot of stuff. So speech to text, patient portal messaging, the video conferencing, video language interpreting that I spoke about. And then also, how do you handle unexpected barriers when things just don't go right? And how to utilize follow-up with healthcare team members. So in summary, my goal was to share highlights of what I learned about clear face masks, which are definitely a very helpful strategy, and how you can advocate for them. The main point that I want to convey is there is something you can do. Actually, there are many things you can do, even in the face of what may seem like overwhelming communication barriers, and you should try.
Thank you so much, Dr. Rennert. We really appreciate your really thorough explanation of how to think about clear masks, what we should take into account when we would like others to use them, and how to advocate. So thank you so much for your talk tonight. For the little time that we have left right now, I wanted to ask one of the questions that came, we won't be able to get to all the questions, but one question came in is, can individual consumers purchase clear masks for medical providers? And do you have a suggestion about that?
Yes.
Or do they have to use the one that the healthcare system recommends, or?
Okay, so there's kind of two questions in there. The first question, I think, is can you as an individual purchase clear masks? The answer to that is definitely yes. They're sold over the websites. We'll provide all of that information. Obviously, as a hearing impaired person, you may want to purchase those masks for your family or friends, but in the healthcare setting, it may work in different ways. So I have been very successful in talking to individual healthcare providers and engaging them to connect with those that need to make decisions about purchasing. So that's one option that you can do. In a systems-based way, I think the issue is that there's no single process in every system. So it really helps to just address it in different ways. I do think that now is a very good time. I think that we are, we're past some of the worst times of COVID. And also I think that, as you would expect, a number of people have requested workplace accommodations. So many larger hospitals or medical centers are accustomed to that. It's not foreign. So it is at the current time though, as I see it, there's no sort of like one thing that you can do, which would cover every system. But I think it's a good idea to do the things on an individual basis, and then also, as I mentioned, the other advocacy ideas, that are maybe more powerful on a larger scope.
Okay, thank you. And just very quickly, another really interesting question came in was, do you recommend bringing the clear mask to the appointment or sending it in advance or delivering it in advance for the medical team to use?
Yeah, so I bring them to the appointment. I think things do tend to get lost if you send them in general, but I think, when you speak to them ahead of time, if they're not familiar with the clear masks, they may ask you for some information about it, and you can educate them about that. Most of the time what you'll get from the staff or the practice manager is, okay, well, send me some information, I'll look at it, I'll talk to the doctor, and that's actually a win. But I do bring the masks with me. I'll tell a very quick sort of personal story. I had gone to an appointment. I did all the things that I recommended. I was expecting things would work out, and I got to the appointment and nothing. So except for an N95 and a face shield and a whole lot of other stuff. I was upset about that. And then the next appointment, which was 6 months later, and I had really advocated for it and gave a lot of information. 6 months later, I never heard anything. Time for another appointment. I said, I don't even want to go. This is going to be awful. But then I said, no, you really have to go. So I went, and I expected that, whatever, I'd have to figure it out after. And I got there, and they're wearing clear masks. And in fact, had also ordered one of these video conferencing language interpretation systems. So you never know where you're going to get. So you should always try.
That sounds wonderful. It sounds like you were really effective in not giving up and explaining your needs, and that's fabulous. So this is the amount of time that we have right now for questions. We want to thank you again so much for your informative information, and we will be including in a follow-up communication the list of the clear masks that were demonstrated tonight, and some other material. Thank you again, Dr. Rennert.
Thank you so much.
Okay, I'm going to have Lori Hannon come back and join us. Thank you.
Hi, thank you, Dr. Rennert, and to Dr. Tom Roland. I hope that you found both of our speakers as interesting and informative as I did. We now come to what's one of my favorite events of the whole year, which is the awarding of our college scholarships to two very deserving high school seniors. I'm going to turn this over to Dana Selznick, who is the director of CHC's Family Programming and Education Center, who will lead us through the scholarship portion.
I am thrilled to begin the next portion of our program, one that continues to be a very special part each year. As an educator, I enjoy working with children as they are very young and watching them grow throughout their entire schooling. As they grow from young children to young adults, CHC's entire team celebrates each of their accomplishments with their families. As our next group of high school seniors get ready to embark on their next stage in life, we feel fortunate to support their accomplishments. And we feel fortunate to be able to present them with the Rose and Irving Schillinger Memorial Scholarship and the Howard Mandel and Ed Graham Memorial Scholarship to two deserving college-bound students. To help me present these scholarships, I would like to welcome Ethan Morabel, last year's recipient of the Howard Mandel and Ed Graham Memorial Scholarship.
Hey everybody, I'm Ethan. I am 19 years old, and I just finished my freshman year of college at the Rochester Institute of Technology. I graduated from Scotch Blandstone High School and was a member of the National Honor Society. I was thrilled to be the recipient of the 2020 Howard Mandel and Ed Graham Memorial Scholarship. 2020, was not what I expected it to be, and many of the traditional experiences in high school as a high school senior and college freshman did not happen for me. But I am pretty used to non-traditional. I did not come to CHC through the traditional route. I was born in the Dominican Republic. I was diagnosed and implanted with my first cochlear implant in Miami, and then spent my younger years when I was going to audioverbal therapy in Ontario, Canada. When my family moved to New Jersey in 2014, we were searching for the same type of family-centered care that we used to in Canada. Frankly, the system in the US scared me and my parents, and we were worried about finding professionals that truly cared. Thankfully, we found the Center for Hearing and Communication. It's a great story how we found CHC. Me and my family went out to our first Broadway show, The Illusionists, and Dana's husband was actually there, and he noticed that me and my brother had cochlear implants, and we started a conversation with my father. He told my dad about his wife and CHC, and then soon after that, my mom wrote to Dana, and we quickly discovered that we had found what we were looking for. Truly, it is a place where you feel like everyone really cares. My brother Gavin and I have had the privilege of being asked by Susan King to speak at the 2017 annual golf tournament, and then play in 2018, which was super fun. And then in 2019, we presented an award to Rebecca Alexander. So that was pretty awesome. My family is always thrilled to get a chance to give back to the places that have helped us. So I am thrilled today to have the opportunity to present the 2021 Howard Mandel and Ed Graham Scholarship and the Rosen Irving Schillinger Memorial Scholarship to the new recipients. I urge you to take the opportunity to give back to the people who have helped you achieve success. I know there are a lot of people who have helped you, me on my journey, and so I just want to make sure you guys help people who have helped you. I want you to continue to advocate for yourself and the accommodations that will help you level the playing field with your hearing peers, whether in college or for your future employment. And remember, be proud of who you are and the challenges you've overcome. You're awesome. Don't forget it. And my number one piece of advice that I can give you both is be prepared to have a lot of free time and get used to it, but also use it. Use it to your advantage. So now I would like to introduce Tommy Hassett, the recipient of the Rosen Irving Schillinger Memorial Scholarship.
Hi, my name is Tommy Hassett. I'm a graduating senior at Chaminade High School and will be attending Rochester Institute of Technology in the fall. First off, I would like to thank all the contributors to the Rosen Irving Schillinger Memorial Scholarship and to those who found my application worthy of this honor. I would also like to thank my parents for their unconditional support in allowing me to chase my goals. Because of their consistent support and the help of teachers, coaches, and everyone in the hearing and communications fields, I'll be able to play college lacrosse at RIT while receiving a great degree in accounting. Thanks again to everyone and have a great night.
Congratulations, Tommy. I look forward to seeing you at RIT next year. Go Tigers.
You too.
And yeah. Now, next, I would like to introduce you all to Max, sorry if I messed this up, Crush Baker, the recipient of the Howard Mandel and Ed Graham Scholarship. So welcome, Max.
Hello, my name is Max Quaish Baker, and I am deeply grateful to stand before you today as the recipient of the Howard Mandel and Ed Graham Memorial Scholarship. Thank you all. Thank you to all those at the Center for Hearing and Communication, where I first got my hearing aids at age 8 and where I was in good hands with caring people like Ms. Jane and Mr. Terry Williams. Thank you also to my friends and family and educators for their support, encouragement, and advice. At certain points in my life, there have been leaps made in my personal journey with accessibility. Hearing aids and an FM unit kind, and generous people, and a pandemic. Attending school in New York City meant 100% remote classes, which in terms of accessibility helped me a great deal. Throughout my life, I have been encouraging people to maintain eye contact with me when they speak. While talking, facing a blackboard comes naturally. Turning away from the lens of a camera goes against the grain. Background noise was significantly reduced, lighting improved, and of course, captioning, text, chatting, and transcripts of lectures were readily available. The adaptations made learning more effective for my classmates without hearing loss as well. I did miss the social part of learning in a school building. I wanted to sit at a table to eat lunch with my friends, to chat in the hall between classes, to sing together on the auditorium stage, to laugh at my teachers cracking a joke. Going out into the world was scary with the threat of COVID-19. My family and I were careful about not exposing ourselves to more dangerous situations. That meant every necessary trip was important in a social and emotional way. I actually enjoyed walking the 5 blocks to my audiologist's office when I needed hearing aid batteries. It got me out of the house, and I got to interact with the staff. The masks, of course, were difficult. After years of gently educating people not to speak with their hands in front of their faces, I had to deal with hidden words struggling to escape protective gear. It actually reminds me of my early days. When in the 3rd grade, I was finally diagnosed with mild to moderate hearing loss and got my first hearing aids. I had a lot of catching up to do socially and academically. Often I felt I'm making up for lost time. However, it is not only my lost time, it is unfortunate for everyone that those precious first few years, my hearing loss went unrecognized, can never be relived with the incredible support I have had after the recognition of hearing loss. We have all learned to responsibly advocate for ourselves and for others. We advocate not only because it benefits the individual, but because of the ripple effects that person has on our entire society. When I entered LaGuardia High School of Music and Art and Performing Arts, I was the first person with hearing aids ever to join the vocal music department. There were many patient and kind people who helped me along my journey to the FAME school. I continued to do my best to pass the kindness on to others. We all learn differently. We all face challenges, but if my challenges are your challenges and your challenges are my challenges, we clear those hurdles and cross the finish line together. We celebrate together. Thank you.
Thank you so much, Max. About the only thing that I can say after I listen to our scholarship winners every year, and this year is no different, is if Max and Tommy represent our future, we really have nothing to worry about. I'm sure it's been a very challenging year for them this past year, and I hope they get to make up in their freshman year the fun that they might have missed out in the senior year. I hope they have a great graduation coming up and a wonderful year ahead. Thank you to Dr. Reynolds, to Roland, to Dr. Rennert. Congratulations to our scholarship winners. And a special thank you or appreciation to our scholarship winners' parents, who certainly have a lot to do with the success of their kids, and especially to all of you for being here tonight. We really appreciate the time that you take to spend with us and hope that you enjoyed it. Please continue to stay in touch with us and check our website for future webinars. Thank you and have a good night.